Good day everyone, welcome to Blackboard Pharmacology. We are in our third video in the series of antihypertensive treatment. And today's question is going to be, can something like Bactrim, which is trimethoprim sulfamethoxazole, causes a diuretic-like reaction? Okay, now you can think about this one, go read it up, find the answer. I'll give you the answer in the end of this video. Great stuff. Today we are going to discuss, let me quickly get to that introduction page. Today we are going to discuss diuretics, calcium channel blockers, beta blockers, and drugs that work on the renin-angiotensin-aldosterone system a bit more in detail. And I hope you've got that charts printed out and ready for you to use, because I'm going to give you something that you can write on that chart in the notes section. Let's get straight to it. Let's start with diuretics. Let's start with the low ceiling diuretics. An example of drugs in this class include hydrochlorothiazide and indapamide. Now this is a first line treatment for uncomplicated hypertension. It's also used often in combination with something like an ACE inhibitor or an angiotensin receptor blocker. The side effects include a change in the lipid profile, so your patient can develop, unfortunately, cholesterol due to this drug. Also hyperuricemia, which can lead to gout, hypokalemia, and an impaired glucose control. Okay, but if we give something like an ACE inhibitor or an angiotensin receptor blocker, we can counteract this hypokalemic effect. Now, something that you have to remember that is often forgotten is that these drugs are a caution in patients that are allergic to sulfas. It has a sulfonamide derivative. It has a sulfonamide derivative on the structure. So you can see there's a sulfur and there's a sulfur. So just be cautious of this. Once when I worked in government, I saw a patient is allergic to sulfur, and I saw it's being prescribed hydrochlorothiazide for the first time. I called the doctor. The doctor was so kind. We changed the therapy and everybody was happy. Okay, so it does happen. It happened once, actually. All right. High ceiling diuretics include furosemide. Now, this basically depends. Shut up. High ceiling diuretics include furosemide. Now, furosemide is more used to treat an overload of fluid. Okay, and they are for patients that are a bit more ill than the one you give the hydrochlorothiazide to. They also have a sulfonamide allergy. They can also cause hypokalemia and gout. And furosemide can be given in a BD dosage intervals. You always want to advise your patients to take that second dose in the afternoon and not at night. You don't want them to be running to the loo all night and get no sleep. Okay, and that's it for your two high ceiling and low ceiling diuretics. Now let's quickly have a look at the potassium sparing diuretics. Now, potassium sparing diuretics are drugs like spironolactone and amiloride. Spironolactone is like aldactone, the trade name. Aldactone. Now, they are used in resistant hypertension and severe heart failure. It doesn't affect the glucose metabolism or the uric acid elimination, so that's good. Now, it's caution when you're giving it to a patient that's already using ACE inhibitors or angiotensin receptor blockers because of the hyperkalemic effect that can happen. They also block aldosterone. If you can remember that figure that we talked about earlier, I can quickly show you. These drugs are going to inhibit aldosterone, and the potassium sparing diuretics are also going to inhibit aldosterone, so you're going to get the same effect from two different drugs. That's why it is an interaction. Okay, then we can quickly discuss the beta blockers. Now let me just get to that page. Beta blockers have some not so nice side effects, which include vivid dreaming, and as well as depression, because they are lipophilic drugs and they cross the blood-brain barrier. But not all of them have this side effects to the same extent. So something like propranolol will give you more of this effect, but something like sutaxol, sotalol will be much better in this instance. Okay, calcium channel blockers. they block the calcium release from the sarcoplasmic reticulum, and then the smooth muscle can relax. Like you're on vacation on the beach, you're there being influenced by calcium and you're just relaxing. Okay. Side effects of these drugs include muscle cramps and muscle pain, because a drug like magnesium, a magnesium supplement, is what you use to treat something like a muscle cramp. And now we are blocking it. We are blocking calcium, which is also a positively charged molecule. Okay. Also blurred vision, also bowel alterations. Okay. Then drugs that affect the renin-angiotensin-aldosterone system. Most common side effects is coughing and angioedema. This is edema around in the face, around the eyes especially, and this is all due to the inhibition of bradykinin destruction or inactivation. Okay, and there you have it. We discussed all of it. I hope you made some pretty notes on the template I made for you. And then we're quickly going to talk about the EDL ladder. Now, what is the EDL? Used in South Africa, essential drug list or essential medicine list, and how they advise us to give this medication. It's not for us to prescribe, so we're not really gonna initiate this therapy. We are definitely not gonna initiate it, but we can double check a prescriber's intentions and the accuracy of a prescription if we have this knowledge. So just quickly give you an overview of that. Usually starting off with hydrochlorothiazide in the lowest dose, which is 12.5 milligram. If the target blood pressure is not reached after 1 month, we add the following: amlodipine or enalapril or an angiotensin receptor blocker like losartan. And we're gonna also give it in the lowest possible dose. Okay. If the target is not reached, increase the dose of one medication every month to their maximum levels. For example, if you are giving hydrochlorothiazide and you're giving amlodipine, you're gonna first increase hydrochlorothiazide's dosage, and then in the following month you will increase the remaining drug. Okay, if the target is still not reached, you can add a drug like spironolactone. Okay, and it can go up to 100 milligram a day. We can also then, if the patient has refractory hypertension, gonna add atenolol. So you can see spironolactone, atenolol, not often used. It's rather going for your diuretics, your ACE, drugs affecting the RAAS system, and also the calcium channel blockers that works on the vascular calcium channels like amlodipine. Okay, let's get to the answer of that question, guys. The answer is Bactrim can act as a potassium-sparing diuretic. They compare it to the drug called amiloride, and it can cause hyperkalemia in the body because it spares that potassium and it increases potassium levels. Yeah, that was just an interesting article I found online. I will link it for you down in the description box below if you want to just read up on it and improve your knowledge. But that's it all for today from my side. That is antihypertensive, the pharmacology, and some backgrounds. I hope you enjoyed this video. Don't forget to print out your PDF so you can use it for your studies and just to recap whenever you feel like it's needed. And then I will link some videos for you at the end of this one that might also interest you. Thank you so much for your support and see you in the next one. Goodbye! Oh, and don't forget to be happy pharmacists. Guys, I've also using my new iPad to make notes for this series that I made, and also to include it into the video. So maybe you can tell me if you like it or not. Do you prefer me working with, would you prefer me working with more typed stuff, or do you like me writing it out? Did you enjoy the interactivity of the iPad? Let me know what you think.